Thank you for joining us for our webcast on mental health at work. Today, you'll get to learn about the Mental Health Commissions of Canada's National Standard for Psychological Health and Safety in the Workplace, referred to as a standard since that's a mouthful, and to get to hear about some case studies associated with the implementation of this standard. My name is Lindsay Coffin, and I'm a Senior Research Associate here at the Mining Industry Human Resources Council. MIR, as we're commonly known, is mandated to identify and address the HR and labor market challenges and opportunities for the Canadian minerals and metals sectors. We collaborate with mining and exploration companies, organized labor, contractors, educational institutions, industry associations, and Aboriginal groups. We are always keen to share the latest research and tools, and today's presentation on the standard and its practical implementation is certainly one of those. To provide a bit of context for today's webcast, let's consider that some aspects of the mining industry may lead to increased stress and mental health challenges. These aspects include the remote nature of mining, especially fly-in, fly-out operations, the long periods away from daylight experienced in underground environments, the cyclical nature of employment, shift work, and long shifts. These factors, combined with the stigma associated with mental illness, may also combine to present a safety risk. Unfortunately, information on current psychosocial risks, specifically in Canada's mining workplace and workforce, let alone any mitigation strategies for these risks, are currently not available in Canada. In addition to this, our review of academic literature on mental health and resource extraction revealed one overarching theme: a lack of empirical research on the mental health of mining workers globally. One study suggests that the private nature of mental health means that its prevalence is underestimated in mining communities. We agree with the argument that mental illness is occurring in the mining communities. As a former exploration geologist, I can remember times where I saw the symptoms that point to the disease. There are many anecdotal reports, in addition to the findings of published research, that drug and alcohol abuse are occurring in mining work camps and communities in Canada, as well as internationally. Substance abuse is a manifestation of mental illness that could be arising from the stress, anxiety, and isolation of mining workplaces. The only quantitative publication available found that rates of anxiety and depression in the mining workforce were much higher than comparative national, rural, and remote figures, particularly for males. The limited research available indicates that the symptoms of mental illness, including substance abuse, stress, anxiety, depression, family violence, and suicide, occur disproportionately in mining communities. Furthermore, literature reviews suggest that fly-in, fly-out, isolated operations, and mining's characteristically volatile employment are likely factors specific to mining that are causing or exacerbating these symptoms. At MIR, we are actively pursuing ways to enhance our industry's access to research and information in this area and start a dialogue about mental health in the mining industry, which is why we host webcasts like these. As with all of Ensemble's webcasts, we have brought in experts to share their insights and know-how. Today, we are joined by Nitika Rewari at the Canadian Mental Health Commission. Nitika is a manager in the area of workplace mental health at the Mental Health Commission of Canada. Her role allows her to oversee programs and initiatives related to advancing evidence-based approaches to protect and promote the mental health of workers and eliminate employment barriers for individuals who have mental illness and are currently not in the workforce. We will hear from Nitika for the next 40 minutes or so, followed by our Q&A session with all of you. Let's begin. Nitika, I will now turn it over to you to tell us about the psychological health and safety in the workplace.
Thank you so much, and welcome everyone, and thank you, Mir, for inviting me to present today and engage with your audience for about 40 minutes or so around what is mental health at work and how do we improve that, and how do we ensure that workers feel productive as well as engaged in their workplaces when they come to work and feel that their employer is addressing mental health at work appropriately. So thank you once again, and with that, I know we're a small group today, so I hope that we can engage in a bit of a discussion and ongoing interactivity during the webinar as well. Like it was mentioned already, my name is Nitika Rewari, and I'm from the Mental Health Commission of Canada, And I have been also fortunate to lead the 3-year study that the Commission just held and released results around. And it's the case study research project that I will be speaking to you about today. So really the focus of our discussion today will be around getting on the same page around what is mental health and what is mental illness. Really, why should employers be looking at this, and why is it an employer's duty to care for the mental health of their workers? What are some of the promising practices that we've been able to identify through our project, the 3-year national study? And what are some of the tools and resources that you can use today to get you started on your journey, as well as what are some of the tools that we are developing currently? So let's talk about what mental health really is. I'll share with you a definition of Public Health Agency of Canada from what they define mental health to be. And it's really the capacity of each and all of us to feel, think, act in ways that enhance our ability to enjoy life, as well as deal with challenges that we face. It is also a positive sense of emotional and spiritual well-being that respects the importance of culture, equity, social justice, interconnections, and personal dignity. So now that we know a little bit about what mental health is, let's also think about what mental illness is. And mental illness, as some people call it mental disorder, causes major changes in a way a person thinks, emotional state, as well as behavior, and it disrupts their person's ability to work and carry out their usual personal relationships. We also have a definition around mental health problem, which is kind of a broader term that includes both mental illnesses and symptoms of mental illnesses, but which may not be severe enough to warrant a diagnosis of a mental disorder. Those, when we talk about stress in the workplace, when we talk about anxiety, if they haven't been diagnosed as such, but people feel those symptoms and they find themselves to be in that mental health continuum of feeling symptoms that prolong more than, say, a day, or prolong their capacity to be resilient and to come back to their productive selves and to their mental health selves. Those are some of the symptoms that we call them as mental health problems. But once they get diagnosed, once they're prolonged to a point where you need medical assistance, you need therapy assistance, you need some type of an assistance, that they now be called mental illness or mental disorder. And it is prevalent in our society. I want to be highlighting the fact that 6.7 million people in Canada were diagnosed with a mental illness, and this is a stat that's coming out from 2011. This is in comparison to about 2.2 million people in Canada who live with type 2 diabetes, or in comparison to 1.4 million people in Canada with heart disease. So when we talk about 6.7 million people in Canada, we're saying about 1 in 5 people in Canada living with a mental illness today. And that's a major statistic to talk about. It means that all of us, most of us, if not all of us, either have experienced a mental health problem or illness ourselves, or know of a family or a friend who has experienced a mental health problem or illness. Let's talk about what that means for the workplace. How many people do you think missed work this week because of a mental illness? Would you say 50,000? How about 100,000? How about 200,000? In fact, we know that 500,000 Canadians in any given week are unable to work due to mental health problems or illnesses. This happened this week, this happened last week, and it will happen again next week. And it is not the same 500,000 people each week either. Really not a surprise when you consider that by age 40, half of us will have experienced or will be experiencing a mental health problem or illness. Now keep in mind that 500,000 people that I just mentioned that miss work each week, This doesn't count those individuals who call in sick due to a lower back pain or headaches that are actually a cover for, say, depression or anxiety or stress, but they just won't admit it due to stigma in the workplace and also in our society around mental illness. It also doesn't count those individuals who have left the workforce or have never been able to enter the workforce due to a mental illness. As well as it doesn't count those individuals who really are suffering but drag themselves into work and are unable to accomplish the tasks that they want to be accomplishing, a term we call presenteeism. Clearly, as you can see, it's a big issue that deserves attention. We know that mental health problems and illnesses are the #1 cause of disability in Canada and account for nearly 30% of disability claims and 70% of total costs. We also know that 10 to 25% of mental health disability costs currently are directly borne by the employer. And the longer that someone is away from work due to an illness, the less chance there is for them to successfully return to work. Some research even points to the fact that if someone is away for 6 months or so, their chance of return to work is about 50%, but it reduces to 10% if that same individual is off 9 months or more. We also know that if unaddressed, the impact of mental health problems are on lost productivity, such as absenteeism, presenteeism, turnover, and it costs Canadian businesses about $200 billion over the next 30 years. That's what's projected. And when I mentioned to you that there are 500,000 Canadians who miss work each week, and that doesn't count those individuals who are calling in sick due to, say, a lower back pain, but really are a disguise for their depression or anxiety or any other mental health conditions, it's really due to stigma. So let's talk a little bit about stigma. We know that stigma is the result of negative or prejudicial attitudes and behaviors that are expressed by people to those living with a mental health problem or illness. It's a destructive attitude and leaves a mark of shame that makes people feel very different and socially excluded. It serves as a major barrier for people to come forward and seek help at a crucial time when their mental health is beginning to decline. We know that about 60% of those individuals who experience mental health problems won't seek help because of stigma. We also know the positive side where if you do help reduce stigma, individuals will seek help sooner, which will lead to their higher likelihood of success and better prognosis. It will lead to a cultural shift in thinking and attitudes overall among individuals, resulting in more acceptance of mental health and mental illness. And it will cause environments to be a bit more supportive around them. We also know that if we all work together to reduce stigma collectively, it will lead to positive outcomes for individuals who have a mental illness. In the workplace, if we do that, we know that it will increase productivity. It will change the culture for the better. It will make the culture more supportive. And it will, again, lead for people to return back to their workplaces feeling supported and coming back to their original selves, as well as being on a journey of recovery that will be supportive through their working environments. But there is a cost. If we don't do those things and we don't address stigma, there is a cost of doing nothing. I've mentioned costs such as presenteeism, absenteeism. Disability claims keep going up. Injuries in the workplace, mental injuries due to workplace environments keep going up. Grievances and complaints, turnover keep going up. This is especially true, it was highlighted in the beginning of the webinar, in the mining sector, because the mining sector is able to see repetitive or dangerous tasks, physically demanding roles, physical health problems, including injury at work or chronic illness. This sector is also used to seeing fatigue associated with long working hours, shift hours, as well as overtime or commute times. Social exclusion, particularly for those working in regional, rural, or isolated settings, away from extended family or social relationships, as well as industry downturn, which can affect people's sense of job security. This is something of an issue we all have to deal with, as well as employers have to deal with. So the National Standard for Psychological Health and Safety in the Workplace allows us to do just that. But before I delve into the National Standard, I'd like to talk to all of you to understand if you are familiar with the National Standard of Canada for Psychological Health and Safety in the Workplace. And in order for you to provide us with that information, we're going to launch into a bit of a poll. If you can answer that poll, I'm going to launch that really shortly. But if you could answer that poll with a yes or no, that will give me an idea of how many of you are familiar with the standard. We'll keep that poll up for about 30 seconds or so. So we'll keep it up for another 15 or so seconds. All right. So what I see is that from our audience today, no one is really yet familiar with the National Standard for Psychological Health and Safety in the Workplace. And this is really important for me to know, and something that we hear most often in other audiences and groups as well. Now, the National Standard's only been around for about three and a half years or so, and I'm really happy that you were able to share this with me, because now I can talk to you a little bit about what the standard is. Sorry, I'm just really having a bit of a technical issue. Oh. Okay, that's perfect. Can you still see my slides? I just want to get confirmation. Okay, I think you might be able to see my slides now.
Yeah, you're good, Nitika.
Okay, perfect. Thank you. So the National Standard was released in 2013, and it's a voluntary set of guidelines available to employers at no cost. It allows employers to systematically address mental health at work, and has been, in fact, downloaded over 35,000 unique times since its inception, as well as, and it's been downloaded across all industries and sectors. The standard encourages employers to address mental health and mental well-being of employees in a great way, so it can reach a large number of Canadians. As I mentioned earlier, this week and every other week, 500,000 Canadians will miss work due to a mental illness. And mental illness is a huge driver for disability claims in this country. So the National Standard then allows us, it's a framework that allows us to look at what are some of the hazards around mental health and mental illness in our workplace. What is our information, such as data around turnover, disability claims, staff engagement scores, etc. What are they saying, and how are they hinting at the mental health state of the organization, the culture of the organization, and what can we do to address that? It's really a prevention and promotion tool, this standard, and allows organizations to look at 5 key elements when it comes to implementation. It incorporates looking at the commitment of the organization and leadership and buy-in from the leadership. It allows you to plan your actions, look at really what your data is saying, look at what your employees are saying, and then plan for the right steps that are eligible for your organization, that are most suited for your organization. It allows you to go into a stage of implementation, actually putting in those policies, programs, and benefits in place that will promote and protect mental health of your own employees, as well as use corrective action or evaluative lens to look at what has worked and what has not worked, so that you can build upon your efforts as you address mental health at work. And of course, the final element being management review, which continues to be the key element where you look at all your data and look at how it's been working and make future directions and future decisions on next steps. And the National Standard for Psychological Health and Safety is no different than any other health and safety strategy that you might be putting into your workplace. Much like any other health and safety strategy in a workplace, it is a comprehensive way of addressing psychological health and safety management system, and also outlines the 5 key pillars that you might be looking at for health and safety anyways. It looks at things like programs, workplace awareness programs, integrated wellness programs, peer support programs. It looks at things such as policies. What types of policies do you have in place that address mental health issues and concerns of your staff and workers? Accommodation, return to work plans, employee recognition policies, etc. It looks at things such as benefits. Are you providing mental health services through your EAP service providers? EAP being Employee Assistance Programs, or EFAP, which is Employee and Family Assistance Programs. Do you have policies and benefits in place for short and long-term disability leaves due to a mental health problem? Do you have prescription drug coverage provided to workers for mental health problems and illnesses, etc.? Are you raising awareness by training your workers and staff, as well as any volunteers you might have, around what is mental health in the workplace? What is mental health in general? How are employees being given the tools to be resilient when it comes to dealing with their own mental health challenges? Is there a policy or training in place around respect in the workplace? Are management being provided the same training so they know how to address concerns when employees and workers are bringing those concerns forward to them? And last but not the least, the final stage or the final pillar being the assessment. Are you looking at what your employees are saying, whether it be, and I'll talk to you about this Guarding Minds at Work tool, but really, are you looking at getting feedback from your employees about what is the culture looking like, and how is the mental health of the workers being protected, promoted, and what needs to be done? Are you looking at the different policies and benefits and programs that you have in place and assessing whether they're working well or not? Are you looking at what you could be doing in terms of identifying the appropriate hazards and risks as it comes to risks associated with mental health of your workers and how the workplace is structured? Now, I want to do a little bit of a quick poll again about, does your organization have these pillars in place already when it comes to mental health, addressing mental health in the workplace? So I'm going to launch another poll to get us started. And if you can click on whether you think it's programs, policies, benefits you have in place, or you have training in place, whatever pillar you think that you have in place around addressing mental health, that'd be interesting to note. I'll launch that and I'll give everyone about 40 or so seconds. Thank you so much. And this is absolutely wonderful information. What it turns out is that most respondents say that they have benefits associated with mental health services. They have some policies in place. Some actually do have some programs in place Very few of the respondents talk about training that's being provided or any kind of assessment. And let me tell you, this is not unusual for me to see when I talk to employers and I talk about what they have in place. But this is also a great way for you to get started. If you look at what you already have in place and you list that out for your organization, and then look at the areas where you may be lacking initiatives in, and then highlight those gap areas as well, that in and of itself, this diagram will give you the right tool to get you started in the next direction. But let's chat a little bit further, and thank you once again for sharing these results with me. And I think you can see them in your screens right now. But if we were to move forward and talk about kind of what is, sorry, I think something happened again. Okay, so what is mental health at work anyways? When we talk about mental health at work, we want to make that concept a little bit less vague for you. We want to make that concept a little bit more tangible. And we'll also want to highlight for you that when we talk about mental health at work, we don't necessarily mean, we don't mean that at all actually, for employers to become therapists for their workers or for employers to become their best friends of their workers. We don't actually mean that when we talk about addressing mental health in the workplace. It talks about now providing diagnosis to workers or providing mental health services directly. It really means addressing these 13 factors that you see on your screen. These are 13 factors that impact mental health of individuals in the workplace. And they have been founded in years of research and evidence. Things such as reward and recognition. How do I want to be rewarded or recognized for the good work that I'm doing in my workplace? How do I want to be involved in my workplace, in my workload, and how decisions are made? That's involvement and influence. Do we have civility and respect for each other in the workplace, which is a work environment where employees are respected and considerate in their interactions with one another, as well as with customers, clients, and with the public that they might be facing? Do we have clear leadership and expectations from our leadership? Do we have clear guidelines as to where we're headed? And do we understand that how our work contributes to the strategic direction of the organization? Those are the 13 factors that essentially address mental health in the workplace of workers. This is not something that you may not have already heard in other places. This is not something that is directly linked to diagnosing an individual in the workplace. This is essentially talking about how we talk to one another, how do we respect one another, and how do we deal with one another in the workplace, considering that we are going to be spending most of our waking hours at work anyways. So let me talk to you a little bit about the case study project and why did we dive into that project. About 3 years ago, the Commission began this implementation study with over 40 organizations across the country, and I'll show you who those organizations are in a second, to see how the National Standard for Psychological Health and Safety in the workplace really will be able to live and breathe in different industries, different sectors, in organizations of different sizes, etc. We wanted to see what are those promising practices across different industries and sectors around implementing the standard. And that's what we released back in March of this year, of what those promising practices are. We also wanted to identify certain tools and resources that are being used by the organizations, and they are finding them to be useful in their journey as they go along implementing the standard. So this is a bit of a visual depiction of who these organizations are. And as you can see, we had organizations from various regions of the country. We had organizations in the healthcare, in telecommunications, in transportation, in private sector as well. There were organizations that were small, that were large, that were public, nonprofit, private, and so on and so forth, unionized environments, and so on and so forth. We also know that about 250,000 employees were impacted as a result of this project if we added up those employees across the organization. So what did we learn? What exactly were those promising practices? We were able to identify 9 key promising practices through this project. We know that each organization seeking to adopt the standard must define their own unique constellation of what investments they're going to be putting in and what are the expected returns, whether things like financial benefit, bottom line improvement, enhancing consistency with organizational mission, greater involvement of their staff and engagement of staff, and well-being. Exactly what resources are organizations going to be able to put in as costs, but also what are those expected returns on investment. And that's really you're defining a business case. Each organization has its own unique business case for why they would be implementing the standard. Ensuring commitment is achieved throughout the organization. And this doesn't just mean at the top level, this means throughout the organization, because there is the need to achieve buy-in from the organization, because it is really about how we deal with one another, and we need buy-in from the individuals that are going to be impacted. One promising practice is also about communication, communicating effectively and widely across the organization, so you know why this is being implemented, but also you're able to share with the organization the results of when you do engage in staff engagement surveys or address guarding minds at work, which really is a free online tool that I wanted to talk to you about that addresses the 13 factors of mental health in the workplace, that allows organizations to assess where their organizations are in terms of what their employees are saying in terms of the 13 factors, and what are those factors that need immediate attention, what are the factors that they're doing well in, and what are the factors that they need to be paying some attention to, but that can happen in a little bit more time. And communicating those results with the organization, and then highlighting what do you plan to do about that? How do you plan to get feedback from the organization, from the workers, to help you address those factors that need immediate attention? Building a culture of psychological health and safety overall. A number of the organizations that participated in the project stated that successful implementation of the standard really did require a shift in culture to embed psychological health and safety in the overall culture of the organization. In the mining sector, the culture of health and safety has traditionally been mostly associated with physical health and safety, and it's mostly been associated with physical safety as opposed to physical health and safety either. So really addressing mental health in the workplace allows organizations to look at their culture and change that culture and embed psychological health and safety in addition to physical health and safety. And I want to go back really quickly to the 13 sites and highlight for you that one of the 13 factors is also physical health and safety. And that contributes to psychological health and safety of an individual in the workplace. We also know that ensuring adequate resources are provided in order to address psychological health and safety in the workplace. These resources may be staff time, funding, access to information, etc. And they may or may not have costs associated with them. One of the key mandates of the Commission was to provide you and other employers with some free resources that you can use that are prepaid, free in the sense that the Commission has paid for it, but free for employers so they can readily access them and use them for their organizations. Like I mentioned earlier on, defining your own business case, why exactly are you embarking on the standard, and then selecting those best actions for your organization is also keenly important. Identifying and managing what those risks are to psychological health and safety of your workers, selecting actions that match those risks, and incorporating best practices and research into the selection process is extremely important. Considering psychological health and safety in the times of change is extremely important as well. We found that employers that looked at managing change while looking at the psychological health and safety of their staff and workers was extremely helpful for them to realize that change in a useful way. And last but not the least, it's sustaining those efforts. Implementing the standard or addressing workplace mental health is not something that you can do in one day, 1 month, or even 1 year. It's a continually improving cycle that I showed you early on, where it talks about leadership, planning, implementation, management review, and those 5 key elements. It's something that you continually look at and you address on an ongoing basis. I want to dive a little bit deeper into 3 of the key promising practices. First being commitment throughout the organization. While implementing the standard, it really requires commitment by senior management, and buy-in needs to be existing at all levels of the organization, which includes middle managers, union officials, frontline staff, etc. Commitment has been repeatedly demonstrated as a critical factor in determining the success of organizational initiatives. Across all the organizations that participated in this project, commitment varied at different management levels, but it became very clear that it needs to be at all levels. Commitment also includes things like transformational leadership. Now, what is transformational leadership? It's leadership that is more of a role model leadership, where you don't just talk the talk, but you walk the talk. And where leaders challenge others to generate innovative solutions to the problems and to the risks that are being identified in the organization. Where leaders have the ability to inspire others and demonstrate a genuine concern for the needs of the employees. It also means all staff are engaged and there's clarity on why we are implementing the standard, what are some of the objectives that we have, and really defining that business case for the organization that is unique to each organization and sometimes unique to the sector and industry that you're in. I talked about communicating widely and effectively. This means top-down communication from management to employees that raises the awareness and knowledge about commitment around implementing the standard, but it also means bottom-up communication, which talks about employees to management, which serves to provide feedback on particular programs, policies, so staff feel involved in this decision-making process as well. It also means incorporating the use of psychological health and safety language as you are communicating in the workplace. And it also allows you to assess the awareness of employees around psychological health and safety. Communicating effectively and widely is extremely important to your journey of addressing workplace mental health. And last but not the least, successfully selecting the actions that fit the needs of your own organization. This, of course, occurs based on the commitment and the planning stages of the implementation process. And of course, you want to be looking at evidence and what are the promising practices around your needs that help you select the best actions. And you want to customize those actions to your organization. And of course, evaluate how those actions were able to deliver, as well as address the needs of your employees. It is important to incorporate that evidence so you know that you're not just customizing actions out of the blue. You are actually looking at actions that have been known to have an impact on organizations. So just want to highlight the fact that when we talked about the implementation and how that this is a continuously improving journey, that you'll find none of the organizations, we collected data on 3 stages, but none of the organizations have implemented the standard 100%. This is because you may never implement the standard 100% because you're always improving upon what you already have in place, and that's okay. You also want to highlight, you also want to get from this graph on the screen here that the baseline, when you talk about the baseline, and the question I just asked you in the poll, how many of you have policies, benefits, programs in place already that may address mental health of your workers in the workplace? Some of you said you have programs in place, you have policies in place, etc. Now, what that told me was what exactly we learned out of the case study project when we measured where organizations were at the baseline stage. This means where organizations were right when we got them started, when they hadn't been implementing the standard. We found out that organizations do have policies, benefits, programs in place already that may impact in a positive way mental health of their staff, but they just weren't calling that the national standard. And that's okay, but that's also a great realization and a cause for celebration that you have things in place that support mental health of your staff in the workplace. And then employers started to improve upon that now that they knew what the standard entails and what that process of implementation looks like. But your organization may be in the same boat, that you are in fact successfully addressing mental health of your staff in the workplace. You're just not calling it the standard, and maybe you want to start looking at the standard and addressing it in a more systematic way. There's a video I wanted to share with you. Unfortunately, we won't be able to play the video on the webinar because I think we run into quite a few technical issues, but a video will be posted in the chat function shortly, so you can view some of the case study organizations sharing their own experiences with you around what their journey looked like and what benefits they saw out of the project and out of implementing the standard. Now I want to talk to you about some tools and resources that may help you with your implementation journey. In 2015, the Commission launched a practical guide called Assembling the Pieces that's on our website and free to download that assists employers to practically implement the national standard. The standard is written in a particular type of language, which can be a bit difficult to navigate for employers that are not used to reading that kind of language. We created a guide with our partners so that it becomes easier to implement the standard. There are checklists in place, there are resources in place within this guide that you can download from our website. And the standard really drills it down to 4 unique steps in the guide: building the foundation, identifying your opportunities, setting your objectives, and implementing the plan. And evaluation is incorporated throughout the different phases, and management review is incorporated throughout the different phases as well. And this guide will help you walk through the standard step by step. We also released a series of videos. We mentioned the 13 factors that impact mental health of individuals in the workplace. We released short cartoon-type whiteboard illustration videos in both official languages that you can also use and download from our YouTube channel at no cost, which are great conversation starters. And what I mean by that is if you host, say, a lunch and learn on one of the videos, say you wanted to pick civility and respect, you could show that video with management groups or employee groups or a mix of management and employees. Show that video, and that video will take you through a scenario of what civility and respect looks like in the workplace. What does it look like if it goes wrong? And how can you promote and protect civility and respect in the workplace? Gives you key tips and tools to address that. And then it allows for a discussion after the watching of the video to address, well, what does civility and respect look like for our workplace? How are we doing that? And how are we demonstrating that in our workplace? And if we are not demonstrating that, what are some of the ways we could be demonstrating that? And what are some of those strategies that we could be using? These are, again, as I mentioned, free to download as well. And I have provided a link that Bridget will be highlighting that in the chat function really quickly, that you can access all those videos. We are also in the process of creating an employee orientation tool, which essentially is an online training module of about 90 minutes that highlights those 13 factors, walks through what those factors look like, and in a quiz type of format, and also ends with the video that I just talked about in this online module. We're currently in the development of this module. For new employees, it will be available at no cost to employers as well, and can be used for new or existing employees so they know what their role is in helping promote and protect mental health in the workplace, what those factors look like, and what they can do to contribute to that journey. We're currently also creating an employer online toolkit for those individuals that have been tasked to address mental health in the workplace or implement the national standard for their employers, and a toolkit that allows them to not only understand the different phases of implementation, but also gives them practical tools, templates, resources that they can use quickly to help them address their and help them progress in their journey of the national standard. You might be aware of the Mental Health First Aid course, which is available, that allows individuals, Canadians, all Canadians, and also individuals in the workplace to really preserve life where a person may be in danger or to themselves or to others. It's really a crisis intervention training. It provides help to prevent the mental health problem from beginning to becoming more serious. It helps promote the recovery of good mental health and also provides comfort to a person experiencing that mental health problem. We have another training program called the Working Mind, which is designed to be interactive and active participation, where it includes a variety of videos and practical application with the ultimate goal of individuals recognizing their own signs and symptoms, understanding where they may lie in the mental health continuum, and being available to have that conversation with their supervisors, their managers, etc., when they need that support, when they need to disclose, or when they need a little bit of accommodation. There is a component of this training program for managers itself where they are well equipped to have that conversation with staff when addressed, when approached by staff. So I really want to thank you again today for inviting me to have this conversation with you. And if I could leave you with 4 key takeaways, it would be that the national standard for psychological health and safety really is that structure or that framework that you might be looking for to help you address mental health in the workplace in a systematic way and implement a mental health strategy in the workplace. We know that research shows that it can be effectively implemented, as shown by the case study project. For you to realize that you have already started on your journey, whether or not you're calling it mental health strategy or the national standard or not, you have, in fact, as you highlighted to me in the poll today, been implementing aspects of the standard already, and it's about now starting to recognize that, celebrate your successes, and also now implement the gaps that you may come across, and that there are tools and resources out there to help you move forward in your journey. Before I call it a day, I want to really hear from you. So if you could identify some key action steps that you might want to take today or might commit to going forward in your journey, and those action steps could be, hey, I want to start reading the standard. I want to give it a read. I want to look at some of these tools and resources that have been highlighted today. I want to talk to a coworker, or I want to talk to somebody in our health and safety committee about the standard and see how we can start incorporating that. Or I want to talk to my management and see what their awareness is about mental health in the workplace and how we can start having a conversation about mental health at work. I just want to hear from you about what you might think are your next steps out of this information and you might want to be doing out of this, the information you received today. So if in your chat function, you might be able to just type in a few words to let me know what you took most out of this discussion. I think people are being shy. People are not talking about what their next steps might be, and that's okay too. You know, there is quite a bit of information that I have shared with you today. So if at any point you want to contact me or let me know what your thoughts are, if you have any questions, I'm happy to answer them. And with that, I really want to say thank you again for having me here. And I want to highlight that the Commission also hosts monthly webinars on workplace mental health, and you can access those previous webinars as well, and also register for upcoming webinars. And with that, I want to thank you all for having me here today, and we'll take any questions that might come up.
Thank you, Nitika, for sharing with us on how paying attention to psychological health can help drive engagement in Canada's workforce. It's time for a Q&A and your participation. We have a couple questions already submitted, so I'll start things off by asking, how would you implement a standard like this in an environment that isn't your typical 9 to 5?
Absolutely, and a very important question indeed. Like I mentioned earlier, one of the promising practices that came out of the case study project was really to define your own business case and select actions that best suit the needs of your organization. Now, a need for an organization in the mining sector might be, what could be those hazards to mental health to our workers when there are long working hours, overtime, working in remote locations, etc. And as you mentioned already in the beginning of our chat today, that there are concerns such as substance use and abuse, stress, anxiety, depression that have already been highlighted. We can look at the best actions for employees when they are remotely working or working long hours. How do we support employees? And a few key solutions to address that really would be to ask the employees themselves, what are those solutions that they need? Providing them training about what mental health and resiliency coping skills could be one way to go. Providing those opportunities for workers to build team environments so they get to know each other when they're working in remote locations together, so that the socialized environment can be built in addition to a professional environment. This helps staff feel less disengaged and less socially excluded when they're working in remote locations. Those are some of the ways that you can start to think about what those hazards might be, and then how do we address those hazards, and how do we address those by defining key actions for our own workplace.
Excellent, thank you. We have another question, and it says, in your career at the Mental Health Commission, have you seen a significant reduction in the stigma associated with mental health? And what do you think brought on the change in attitude?
Absolutely, and I have to say that I absolutely have seen a reduction in the stigma associated with mental health over the last many years. One of the ways that has happened, and I give credit to Bell Let's Talk, as you may already be aware of that, is those conversations are starting to happen. Those conversations and those disclosures are starting to happen, and people are starting to feel that they're not alone in this journey. They're starting to feel that not only does mental illness impact them, but it impacts their friends, relatives, and close family. And this is something that has now started to become more of a conversation, as opposed to, say, 20 years ago, 30 years ago, when it was starting to be more of a label on the person, and there were so many myths associated with the individual who might be experiencing a mental illness, that they can't be productive, that they're violent, that they will not be successful in a working environment, et cetera, and et cetera. Those myths are starting to be dismantled a little bit, and we're starting to see that those attitudes are changing. But we do have a long road to go ahead for us as well, and I would encourage all of us to play a role in reducing that stigma on a daily basis.
That's excellent. We have a question about how to address mental health in the workplace. Do you think it should be addressed as a health and safety topic in dialogue, or should it be also discussed as part of cultural competence and diversity training?
I think there's a place for the standard in both. Most typically, it begins as a health and safety dialogue, but once employers are further advanced into addressing workplace mental health, they know that they will not be able to address this successfully if the conversation is contained within the health and safety bucket. This needs to become part of the culture change. And mental health in the workplace, when it comes to things like civility and respect, you touch upon respecting the views of diverse populations and diversity in the workplace as well. So mental health really needs to become integrated in the way you look at, in the way you do business, in the way you look at organizational culture, in the way you address health and safety in the workplace overall. So I would say it needs to be within both.
Thank you very much, Nitika. To our audience, we are at the end of our Q&A. Thank you for all of your questions, and thank you, Nitika, for sharing your experience and wealth of knowledge on this important topic with us. Unfortunately, our time has run out. Please stay connected. Let's continue this conversation in our online space. If you have a question for Nitika or myself, post it online and we'll do our best to get you an answer. Goodbye, everyone. Enjoy the rest of your Tuesday. We will see you next month for our webcast titled Diversity in Mining Today, What the Research Says. Have a great day.
Thank you.